Judith Curry, Patient Experience and Volunteer Manager.
Hello, I'm Wendy McFadden and I'm the Safe Care Lead for Clinical Effectiveness.
Hiya, my name's Ellie and I'm a volunteer at Gateshead.
In October 2020 we had the opportunity to complete an expression of interest for some funding from NHS England and Improvement's winter volunteering programme. We had received a number of concerns from families struggling to get in touch with their loved ones while they were here with us as inpatients, and this was due to the current visiting restrictions. In response to this, our project was to implement patient experience volunteers. The volunteers would support patients using tablets to have FaceTimes with their relatives. They would also help to do emails and letters, as well as chatting to patients, playing cards and dominoes. It is hoped that the patient experience volunteers will support the patient experience and make that better, but also help staff on the wards by reducing phone calls from relatives and allowing them to do their clinical duties. We are delighted to have been awarded the maximum £20,000 to implement the project.
As Wendy has just said, we're absolutely delighted to get the funding of £20,000. The £20,000 being used to purchase iPads, volunteer uniform, onboard new volunteers, and also the funds will be used to evaluate the project. All volunteers were risk assessed prior to going onto the ward, and as part of the local induction I also discussed strategies with the volunteers with regard to strategies to do with any emotion and any possible conflict resolution. A role profile was designed. This was advertised on NHS Jobs. We shortlisted for 26 and 9 volunteers are actually in the role at present. The project started on Ward 4 following a concern that was brought to the attention of the Patient Advice and Liaison Service. This concern was about communication between a patient and her son. The use of the iPads and the visits to Ward 4 has been a huge success. We have received excellent feedback from ward staff and our wonderful volunteers.
I have been working on Ward 4 for 3 weeks now, doing volunteering with the iPads and talking to each patient, and I think it's really enhanced me wanting to go into my career as adult nurse. It just shows you how much the patients need social interaction to help them get through it every day, and especially when they can't see the family. Even just a little chat helps the patients each day, as that's what they don't get, especially with no family coming in. Bringing new clothes in and showing them exactly what they've got, doing dominoes and playing games, and just having a little chat, like I said, it really helps and makes them really a lot happier, as it can be long, daunting days.